We know we're getting older, and maybe we've even cared for an aging parent, diving headfirst into their health care, their finances, and where and how they're going to live. So why do we avoid thinking about and planning for our own aging? Sharona Hoffman is here to help us face the possible pitfalls we'll encounter as we enter our Act 3, Retirement and Beyond. Sharona is the co-director of the Law Medicine Center at Case Western Reserve University and the author of Aging with a Plan, How a Little Thought Today Can Vastly Improve Your Tomorrow. So it sounds like information we all need to think about. So one of the big considerations as we age are health issues. I mean, it's expensive, and caring for your own personal health, and the kind of the nucleus of this book started with your own health care issues and that of your mom. So tell us a little bit about that.
Well, when I was 29, I was living alone in Houston with no family around, and I became very ill. And it turned out that I had a borderline malignant ovarian tumor that was very large. It was taken out with no need for chemo or radiation.
That's good.
And I was very lucky because I had really good friends and family that rushed to my side. 6 months later, my mother was diagnosed with breast cancer. She lived in Michigan and decided she wanted to move to Houston to be cared for at MD Anderson Cancer Center. So she moved in with me into my one-bedroom apartment. And I wasn't sure about this at first, but we ended up having a wonderful time, and she did really well. She lived for 18 years after that with no cancer. And so that taught me a whole lot about being a patient, a caregiver, about healthcare, insurance, the need for support systems, and it really started me on my journey of being interested in these issues.
Okay, and healthcare is a big concern, but it's not the only concern that we have when we age, right?
Absolutely. You have to be aware of financial and social and legal issues. Finances can determine the quality of health care that you get. They can determine where you can live. Can it be in a nice setting? There's also legal issues, and I talk about a lot of legal documents that you should prepare for yourself and for your loved ones. And then there are day-to-day challenges, such as driving. Should you still be driving? How do you get meals prepared if you can't do that for yourself? The list is almost endless.
Yeah, driving is a big one, though. So, and you write about all of that and more. So what's the first step in proactively planning for retirement and beyond?
The first step, I would say, is getting a hold of your finances. You really need to understand retirement expenses, and even if you're well insured, there are going to be considerable medical expenses that aren't covered. You need to know how to save. So it's very important to, if you can afford it, to get financial advice from financial professionals. You'll also need to think about, should you be purchasing long-term care insurance? Is that a good idea for you? Should you be looking into reverse mortgages? So very complicated decisions that you need a lot of advice about.
Okay, and some people have a great network like you did, but others don't. So where do you turn for help if you don't have that kind of network?
Yeah, and that's actually a personal issue for me because my husband and I do not have children, so in the future we may not have as good a network. But happily, there are emerging service professions that are designed to help people who are either elderly or disabled and need some assistance. So you should learn about daily money managers, geriatric care managers, elder law attorneys, all sorts of people that can help you with different things in the home. There's a lot to learn about, but there are a lot of resources. And it's important to educate ourselves in advance because I've learned the hard way. When you're in the midst of crisis, it's really hard to make, very hard to make good decisions if you don't know anything about the problems that you're facing.
So buy the book and good advice. And even if you previously planned for retirement, your Act 3 includes a lot more decisions that are best made before a crisis occurs. For help, look to Sharona Hoffman's book, Aging with a Plan. As the subtitle says, a little thought today can vastly improve your tomorrow. My thanks to Sharona for joining us today.
To order the book, Aging with a Plan, visit www.amazon.com.